And we're going to begin on this Friday in Nova Scotia, where the staffing crisis that has gripped hospital emergency rooms has become a personal tragedy for yet another family. On December 30th of last year, Charlene Snow died at home. She just returned home after waiting for 7 hours in the emergency room of a hospital in Sydney on Cape Breton. It's another incident that has a family raising the alarm about a broken healthcare system already under scrutiny for long emergency room waits. We begin our coverage this morning with Brett Ruskin. He's live in Halifax with this details on this personal family. Good morning, Brett.
Good morning, Heather. We began the week talking about this tragedy in a Nova Scotia emergency room. We're ending the week as well with that. As you mentioned, Charlene Snow went to hospital. She lives up in Cape Breton with her husband, went to hospital on December 30th. As you mentioned, was there for 7 hours waiting. She was complaining about jaw pain as well as a sudden onset in flu-like symptoms. Waited and waited hour after hour. By around 7 o'clock in the evening or so, she asked staff, listen, how much longer is this going to be? And they told her that she likely wouldn't be seen until the next morning. She went home and then died about an hour after walking in the door. Now, again, just the latest death resulting in or an aftermath of waiting a long time at an emergency room. We actually spoke with the daughter-in-law of Charlene Snow. Here's what she had to say about the situation.
I just feel in my heart that it may have been preventable and that my daughter would still have her Nan. And so if we could just understand why she's not here and what role the emergency department played in that.
And so since this tragedy, she has now started and created a website to offer the opportunity for other Nova Scotians experiencing similar heartache or similar stories, problems accessing care through the emergency room to share their stories online. As we know, one of those stories has to do with 37-year-old Allison Holtoff, who's the story that we told earlier this week about having waited 6 hours in an emergency room, complaining of increasing stomach pain, and she died in hospital as well. So one of many stories that we're telling all around this strain, this bottleneck in emergency rooms, Heather.
Brett, we'll look at that website and see the stories that are being reported there already based on the family's efforts. Of course, this is a situation that is not limited to Nova Scotia. It goes beyond the emergency room. So again, take a look at the scope of all of this and the source of long waits and the issues around getting care.
Well, yeah, healthcare officials say, if this was just one specific problem in one specific spot, it might be easier to solve. Just fix that one thing. But it unfortunately is not one thing in one spot. It is, in fact, a bottleneck at the emergency room caused by other problems, caused by people who don't have a primary care provider like a family doctor to provide that initial level of care, so they have to go to the ER instead. It also downstream in the healthcare provision stream, it also has a lack of available beds for people to be cared for in. Here is one health expert talking about that lack of bed causing this bottleneck. Have a listen.
The link between those beds and what happens in the waiting room is linear, and right now exponential. In a bottom line is, if you have a plugged pipe and they can't move, it's unlikely that the waiting room is going to empty.
And so waiting rooms not emptying, people not being seen, all kinds of problems down the chain. As for what happens next, what the fix could be, Premier of Nova Scotia Tim Houston has said that he plans to spend the money, fix the problems. He campaigned in the last election primarily on fixing and improving healthcare in Nova Scotia. Obviously a problem here in this province, but also all across the country as well. Heather.
Brett, thank you very much. Live in Halifax this morning.